When we talk about AI governance, most of the time it's about data, risk, and technology. But in healthcare, that's a whole different ballgame. The stakes are just profoundly human. So today, we're diving into the leadership mandate for AI governance in a clinical setting where every single decision matters. So let me ask you a question right off the bat, especially for the leaders listening. In your organization, what is the true cost of one single AI error? And forget about dollars and cents or system downtime for a second. Think about your core mission. Because in healthcare, the cost of an error is never just a number on a spreadsheet, is it? It's a patient's outcome, it's a clinician's critical decision, it's the trust that your entire community places in you. And that is what separates AI in healthcare from everything else. Okay, so let's get specific. Let's break down exactly why AI in a clinical context is such a fundamentally different kind of challenge. We're not talking about just any algorithm here. Clinical AI is literally woven into the fabric of patient care. It handles the most sensitive data imaginable, it influences the day-to-day workflow of doctors and nurses, and its outputs can inform life or death decisions. This isn't some futuristic theory. This is happening right now at the point of care. But here's the problem. When you take a standard one-size-fits-all governance model and try to force it onto this unique environment, well, it just doesn't fit. It's like a square peg in a round hole. And it creates a dangerous gap, exposing the organization to some very tangible, very serious risks.
I mean, this comparison says it all, doesn't it? On one side, an AI makes a mistake in e-commerce and you get a bad product recommendation. It's annoying, sure, but it's trivial. On the other side, an AI error in healthcare could contribute to a wrong diagnosis. The impact is just staggering. They're not even in the same league.
As a leader, you've got to mitigate 5 core risks. First, inaccurate outputs that could lead to the wrong treatment plan. Second, privacy failures with the most sensitive data a person has. Third, algorithmic bias, which can make health inequities even worse. Fourth is what we call shadow AI. That's undocumented usage, and it creates massive liability. And finally, there's the very human tendency to just over-rely on a tool without thinking critically. Believe me, these aren't abstract threats. They are daily operational realities.
All right, now that we've set the stakes, let's pivot from the problem to the solution. There's a clear, actionable framework here that's designed specifically for leadership. And let's be absolutely crystal clear on this. Good governance is not an IT checklist you can just delegate and forget about. It is a fundamental leadership mandate. It's about accountability, it's about strategy, and it's about protecting the core mission of your organization. A really solid framework is built on 5 pillars. 1. You have to clearly define which AI use cases are actually approved for use. 2. You have to mandate meaningful human oversight. A clinician always has to be in the loop. 3. Enforce strict, rock-solid data controls to protect patient privacy. 4. Have an incident response plan ready before something goes wrong. And 5. You have to require ongoing review of all your AI models, because these things are not static. And what this kind of framework does is establish crystal clear lines of accountability. It ensures there's always a straight answer to the question, who is responsible for making sure this AI is safe and effective? It covers everything from patient safety to the overall risk for the organization. No more gray areas. Now, I know what some of you might be thinking. This all sounds like it's just going to slow us down. Let's tackle that idea head on, because the purpose of governance isn't to be a roadblock. It's designed to be a strategic enabler. And here's the payoff. Strong governance doesn't slow innovation down. It actually creates the confidence and the safety net your teams need to move faster. It replaces uncertainty with clarity. It gives you the guardrails you need to accelerate safely without taking on these huge, unacceptable risks. And that really is the ultimate goal here. It's not about putting the brakes on AI. It's about building the systems that make every single AI adoption safer for patients, clearer for providers, and, frankly, legally defensible for the entire organization. So I'll leave you with this final thought. Take a hard, honest look at your current approach to AI and ask yourself this. Is our strategy built for sustainable, safe innovation? Or is it built for future litigation? The choice and the responsibility ultimately belongs to leadership.